Hi, I'm Louise Schaper. Firstly, I'd like to say thank you to Dr. Bandar Al-Kanawi, who invited me here today, and thank you so much for the invitation. I'd also like to acknowledge the traditional owners of the lands in which we meet today and pay my respects to elders past, present, and emerging. Today, I'm speaking to you from my apartment here in Melbourne in Australia, and this is Warrindigi land. I'd also like to pay my final acknowledgement to you. Yeah, you and the 90,000 odd friends that you brought with you today. This is probably one of the, if not the biggest digital health conference ever held on the planet, and you are a part of it, which is pretty exciting. And you know, it's so great to see such a massive community get together today to discuss all things digital health, because it's only by collaborating and working together, keeping in mind that the reason that we do what we do is all about the patient. It's about providing high quality patient care and improving health outcomes, whether that be for the individual or on a population level. And by collaborating and never losing sight of why we do what we do, we will succeed. Now, it's an honour to speak with you today, and I look forward to your questions at the end of the session. So I work for the Australasian Institute of Digital Health, and we are based in Melbourne. And basically we're a non-profit membership organisation, and our business is all about leading and supporting those who are delivering the future of healthcare. Now, last year we released this report, and I wanted to bring it to your attention. So thanks to my colleague David Rowlands, who authored this. What is digital health and why does it matter? You're probably thinking, and maybe you do yourself, you use the terms interchangeably with digital health, e-health, health IT. Is there a difference? Does it really matter? I say yes, that it does matter. Not that I want to get into academic semantic debates on language today. However, if we look at the era of digital health, we look at what's come before, and effectively we're looking at, in the past, dating back to the 50s, we had computerized IT-based systems that were applied to healthcare. At first, they were not specifically built for health, but they were applied to healthcare. And we looked at technologies that were available, used in other industries, other sectors. How can we make use of these in healthcare? And then it progressed to quite recently, actually, where we were looking at purpose-built applications specifically designed for healthcare, whether that be in your GP clinic or at a hospital setting. Community care, the whole bit. So how is digital health different to these waves that have come before? And it is very different, because now what we're talking about when we talk about digital health, it's really about the application of healthcare in a digital world. So think about it. How does healthcare need to exist in our world that is becoming increasingly digital? I've got 5 computers in front of me. If I include the one that I'm wearing, you've probably at least got 2. You know, I'm coming at you virtually. Our world is increasingly being digital. It is infiltrating every aspect of our lives. Not for everybody, but for the majority that is happening. So how does healthcare need to reinvent itself? How does it need to exist? How does it need to be? How does it need to transform in this digital world? This digital health era is characterized by 7 shifts. So we're looking at changes for citizens and consumers, centricity. We've got new entrants, new players into the system. We've got convergence happening everywhere. So that's industry convergence as well as role convergence. And we've got the origin of data that's changing. Analytics and algorithms are going to just skyrocket in terms of their importance. And it's also broader than health. And finally, those shifts result in changes to all sorts of things. And I'll leave you to read the slides for yourself rather than read them. But we're looking at a massive disruption to healthcare, and many of you are experiencing that and have been experiencing it, and hopefully are leading that charge as well. So in regards to what's happening right now with the COVID pandemic, is of course you can't escape telehealth. Telehealth, telehealth, telehealth. A lot of countries used to refer to it as telemedicine. It seems everyone's adopting telehealth now. So here's an article from April from Arab News saying that here in Saudi Arabia, telemedicine is on the rise amidst the pandemic. Well, that is actually a trend that's being replicated across the globe, of course. Globally, we have just seen that telehealth has been ignited in response to the pandemic. In an effort to flatten the curve and keep people healthy, we've turned to telehealth to keep people out of the healthcare system as much as possible and to keep them safe. Now, we can continue delivering care. Many healthcare professionals are now delivering care remotely. And that's not just doctors and nurses and hospitals, it's happening in the community. Midwifery, physiotherapists. My partner saw an osteopath that he'd never met before. He saw him via telehealth to fix his shoulder. And good on you, Declan. Thumbs up to you. You really helped. Now, whether it's India, Middle East, Saudi Arabia, Australia, the United Kingdom, the United States, in all aspects of our globe, regulations and impediments have been lifted and significant financial investment have been made by governments and the healthcare sector to give telehealth its moment in the sun. Now, to say that there is a lot of money being invested in digital health and telehealth this year is pretty much a massive understatement. Investors are convinced that a preference in healthcare to maintain the status quo just doesn't exist any longer. And now with that barrier removed, they're expecting to see new ways of delivering healthcare will become our post-COVID norm. The graph, and thanks to Rock Health for that, $5.4 billion in venture capital went into digital health in the first 6 months of this year, and that's just in the United States, and it is the biggest amount they've ever seen yet. And last week, after announcing an 85% jump in revenue, the US telehealth giant Teladoc announced a merger with Livongo to the tune of $18.5 billion. And if that doesn't strike you as crazy enough, a 3-year-old startup called Row just raised $200 million United States with a $1.5 billion valuation to transform itself from a company that was treating erectile dysfunction until recently to a telemedicine service. Now, just in case your eyes are dazzled with all of this, it's worthwhile noting that telehealth is not new. In fact, the concept of a radio doctor was predicted almost 100 years ago. And you can find these images on the internet. I think they're wonderful. They're very cool. Now, when all this happened in Australia, our government was fond of saying that they enabled 10 years of innovation to take place in 10 days. And other countries have said they've done 5 years of innovation in 5 days or 5 weeks. And telehealth has actually been around though since the 1950s, and it has technically been very feasible and not commonplace everywhere, that's for sure, but it has been happening for the last 20 years. So the difference now though, it's scale. Outside of the healthcare system, how many people would have heard about or let alone understood what telehealth was prior to the pandemic? Not you, of course, and your 90,000 friends, but you're probably now not the only one in your family who is talking about telehealth. And if you're like me, your family finally has an understanding of what it is you do, or at least they think they do. Many healthcare systems have seen a dramatic rise in telehealth, and the majority of people are actually first-time users from the clinician side as well as the patient side. Changes that would normally take months or years, or in a nod to those who have been advocating for telehealth for a very long time, decades, have occurred within days to weeks. This has led to a chorus of voices echoing for telehealth. It's here to stay. So will this change be permanent? And if so, to what degree? Will our healthcare systems and the mode of delivery of care be forever changed and reflected on as before COVID, or before 2020, before COVID-19, and after COVID-19? Now, one thing is for sure, and that is that we are undergoing a paradigm shift. The healthcare sector has shown that when motivated by patient care, we're innovative, we're creative, we'll get it done. And I mean, the healthcare system and everybody who works in it is just to be congratulated for the amount of innovation they have managed to achieve in a short period of time while dealing with a pandemic. So healthcare is changing and evolving. Healthcare, of course, that was once delivered in the exclusive buildings of doctors' offices and hospitals will increasingly reach us, consumers, over a phone, over a video, over an app, a retail clinic in people's homes and in their communities. So how do we prepare the workforce not to be passive recipients of change, but to be architects of their own destiny? Like this cartoon, I'll leave it with you. Now, with this rapid upscale of telehealth, it has shone a light on the fact that we need to do a lot better at preparing our health workforces for more digital ways of working. The majority of clinicians haven't really used telehealth before, and what's happening now has left many feeling quite overwhelmed and burdened with the pressure of using a modality through which to deliver care that they have had very little prior experience with. But as I said earlier, despite this, they did prevail, they have prevailed. Although I would say that, not a little bit dissimilar to this cartoon, that the majority of telehealth consultations globally are actually being conducted via the phone, not via video. I think it's fairly safe to state that healthcare delivery in the post-pandemic era will not be as we know it today, or certainly as we knew it 6 months ago. If we accept the premise that telehealth is here to stay, then we have to get to work. We've got a lot of innovation to do. We have to design systems of care and delivery that prioritise the patient and which support clinicians, not just to navigate their way through this system, but to lead the effort. I believe that there are 2 universal truths that we can expect. Number 1, and first, we know that the approach will not be universal. It will vary, with different preferences for technology use based on the technology availability and access, patient profile, personal preference, and a raft of different factors. And secondly, that the business models of healthcare will need to be rewritten. And this is pretty much universal. So every single healthcare organisation is going to have to rewrite their business plan. What will we see? Well, firstly, we're going to see a virtual first approach, where a virtual triage session will determine if a face-to-face appointment is required. Secondly, we will see clinicians and patients, at least I hope for this one, clinicians and patients working collaboratively to decide together on the best modes of healthcare delivery that best meets the patient's needs and their expectations. Also, I predict that it'll bring back the idea of a house call, where virtual care subsumes the traditional remote consultation to be combined with remote monitoring, coupled with periodic in-person visits from clinicians and carers. And fourthly, we will see the rise of specialist virtual-only providers. And that has certainly been very controversial here in Australia, and it probably has in your part of the globe as well. So what do we need to do to deliver healthcare in the post-pandemic era? We need data. Firstly, we need good quality, highly reliable, available in real-time data. The sources of data. The data will come from increasingly from multiple sources. More and more, it's going to be generated outside of traditional healthcare systems, from sensors in our environments, on our phones, and of course from the patient or citizen. Thirdly, data interpretation. So here is where we will see an increased role for artificial intelligence to help us manage all of that data and to ensure it is utilised effectively. Fourthly, standards, data and technology standards. It's about time, I think, as the healthcare sector, that we stood up and said that we will no longer accept technologies that aren't built to interoperable standards, that enables data to be captured and flow to where it needs to be with appropriate privacy and security protocols in place, of course. The data needs to flow to where it needs to be to deliver high quality of care to individuals and for populations. And a significant challenge that we have is the digital divide. We would like to think that in this day and age, we could deliver a healthcare system and a technology that's backing up that healthcare system where no person is left behind. Unfortunately, that is far from actualities in most places. Here's a couple of articles just from the last couple of weeks that have been published, a study from America and another one in the UK, pointing to the surge in telemedicine and telehealth throughout these countries is unfortunately leading to an inequity in access for people who don't have access to those technologies. We cannot turn a blind eye to this problem. We need to face it. We need to do something about it, and we can. Healthcare delivery in the post-pandemic era will actually also have workforce challenges, and it's the workforce that is super important. It is often neglected. I know, like, you would have your own experiences where you feel supported, and other things you will find that you don't feel as supported. On a large scale though, we have a lot of room for improvement. Upskilling the workforce in digital health does not mean that we take the majority of the healthcare sector, we put them in a room and we train them on how to use a piece of IT equipment. We need to do way better than that. Firstly, we need specialists that specialise in health informatics and digital health. We need to increase the digital health literacy across all clinical professions. So if you think about that, it's like if you're a surgeon or if you're a physiotherapist, I don't want to be a specialist in digital health, that's fine. I just want to be a great clinician. So it's the year 2020, it's the year 2021, in the future, what is it that I need to know about digital health to be the very best clinician that I can be? And thirdly, we need to define and set standards for professional practice and professional practice guidelines. Fourthly, skills development and validation. We need tailored education, we need certification programs and continuing professional development programs that provide professional career pathways and professional recognition for all. We need accreditation and proper global accreditation of our education programs, and we need to really monitor and give feedback to the healthcare organisations regarding their digital maturity. Finally, when it comes to workforce development, we need to make sure that we're not going to allow technology to be a replacement or a solution for understaffing and resource constraint issues. It's not a panacea either. Technology has to be seen, and it very squarely sits in the healthcare system as being a tool in our toolbox. It's an enabler of healthcare. And at the moment, we aren't utilising it anywhere near as much as we can. There's a million other topics we could talk about, like artificial intelligence more, digital humans, all sorts of things that will expand our current landscape of telehealth and digital health. But we always have to make sure that when we talk about what we do, it is all about putting the patient first, maximising the outcomes for the patient, maximising the data utility to ensure that those outcomes are maximised for patients and for a population as well. Now, thank you very much for your time today. As I said, it's been an absolute pleasure to be here with you today. I look forward to your questions, and I can see that they have been flooding through. Thank you very much, and I look forward to speaking with you soon. Thank you.